It's Dr. Regina Nelson with Ask Dr. Reg. Thanks for joining me today. I have a question for Maddie, and now she's got a patient appointment set up with me too. But I asked her if I could use this for the Ask Dr. Reg show, and she said I could because she got a hold of me to ask, how do I find a medical doctor who actually knows about cannabis? And I have actually now referred her for her recommendation to a doctor who has come through the condition certification class. I have carried CME accredited classes for doctors since 2015 because my frustration as a patient was paying a doctor at that time $150, $175, $200 for him to go, so why do you need cannabis? Go through a little checklist with me and give me a recommendation. Do you have any questions? And I would say, yes. Can you give me some ideas on how I can use this better? What I can do? And I just, no. There were no answers. And once I started putting some of these solutions together, I started paying the same sum of money to go for a recommendation to have a doctor pump me for information on how to treat patients. So I put together classes. I was like, come take my classes and maybe you can help patients. And I've had hundreds of doctors from all across the country. I've gone specifically to Germany and to the UK to educate nurses, but ended up training some doctors along the way too who felt like it was really important to understand. And it is, because we all have an endocannabinoid system, and phytocannabinoids are fabulous in helping people manage a wide variety of conditions, and they offer some mild negative side effects, but not any fatal negative side effects. So, thank you for the question. Look for a doctor that's condition certified. And if you can't find one, get your recommendation, set up an appointment with me. I often give people a discount because of bad experiences they've had other places so that they'll come, get the information they need, and then go out and share that information. That comes back to help me too. But I've been a patient. I've written about it a lot. It's a frustrating thing. So I'm sorry that your doctor doesn't know more about medical cannabis. If they are writing recommendations, I really believe they need a baseline of education, and that's why I offer the condition certification program. And I do have a lot of doctors in Oklahoma that did that when that market opened, and trying to get out into some of these newer markets now that COVID's lifted and all those kind of things, because I think it helps in those new markets to have some doctors who have some basic understanding and they can point you in my direction. I'm risk management. I'm kind of falling between doctors who can't write prescriptions and medical dispensaries who cannot give you medical advice. I'm risk management. I'm a PhD, but I'm a patient, and I've got some just basic guidelines that will help you through this whole process. And I'm not a medical doctor, but sometimes it doesn't really matter. Do you know all you need to know about the endocannabinoid system, or can you help a patient develop a cannabis therapy plan? If you'd like to know more, check out the condition certification program. It's now on LearnWorlds. You can get there through my website at reginanelson.com.